Alright, how you doing today?
I'm good. How are you?
I'm doing good. I'm doing good. My name is Ross Mango, and I'm a PTA student at Penn State Hazleton. Is it okay if I work with you today?
Yes, of course.
Great, great. Before we get started, can I get your name and your date of birth?
It's Matthew Buganji. My date of birth is 3/7/2000.
Okay, and do you know where you are today?
Penn State building, Penn State Hazleton.
And what day of the week is it?
Today's Thursday.
Cool, cool. Yes, those things are correct. Is it okay if I work with you?
Yes, of course.
Okay, just double checking. All right, so today what we have planned is that I know you're having some problems or some balance issues in general, which we're going to be working on, and I know that you are experiencing a little bit loss of sensation and understanding of like where your leg is in motion or when you're seated. And then we're going to work on a proprioceptive test, and I'll get in more depth while we do it, but I'm just letting you know what I have planned for you today. And then we're going to do a Tenetti test, which is just a balance test, just to see where you are in balancing and how we can move forward after that. All right. So before we get started, I want to ask you about your pain. What's your pain level right now?
It's minimal. I would say like a 2 out of 10.
2 out of 10 pain. And where are you feeling that pain?
Just mostly in my like upper right hip. I feel it more when I'm trying to like bring it up.
Okay.
When I'm trying to like walk or stuff like that.
All right.
I kind of feel more that way.
Okay. And how does this affect you in your life?
If I walk, I notice I've been fatiguing a little bit, and I kind of like don't know if my right leg is there or not, if you know what I mean. Sometimes I like double check, like to look down, just make sure my right leg is there, if you know what I mean.
Mm-hmm.
I do hope that I would like to get some of that feeling back. That's what I'm mostly worried about.
Mm-hmm. So you would say that a goal is to just get that feeling back?
Yes.
Okay. All right. Any issues at work?
I mean, both at work at home, I do walk around a lot when I'm taking chores or doing stuff at work, so I do notice that I fatigue quick. What else? Maybe like some pain if I do too much, but normally I don't really feel when I'm doing anything, but just like happens when I'm doing too much, if you know what I mean.
Yeah, I can understand. And again, hopefully some of the things that we're working on today will help us get an understanding of where you're at and how we can build on that.
Yeah.
So before we get started, I just want to do a quick test.
Sure.
If you don't mind,
Yeah.
can you just like lower your pants and lift your shirt, and I'm just gonna check just this region right up here.
Here? Okay.
The skin is intact. Do you feel any pain here?
No.
Any pain here?
No.
Okay. Alrighty. So what I'm going to be doing first, before we do anything, is I want to apply this. This is called the gait belt.
Okay.
And this is just while we're doing some balancing and standing. I'm always going to be right here next to you, but this is just something that I can hold on to so I can help you get back your balance. Okay?
Okay.
Alright, so I'm just going to get like this. Alright, lift your hands for me, please, in the air, towards the ceiling. Thank you.
Okay.
Alright, and then let me know if this is too tight.
Sure.
That feels good?
Yes.
Okay.
Just right.
So now, what we're gonna do is I'm gonna be getting you up on the table so we can get some measurements first.
Okay.
And just see where you're at with that. So at the count of 3, I'm gonna just be here holding on, and I want you to stand up.
Okay.
At the count of 3. 1, 2, 3. All right, and then I want you to just, if you can you hop on the table. Nice. Comfortable?
Yes.
Very nice. All right. So what I'm going to be measuring is, thank you. I'm just going to be measuring your external rotation of your right hip. And that's just the motion of you doing that.
Oh, I see.
Mm-hmm. Mm-hmm. And there's no pain with you doing that motion?
No.
All right. And then can you just do that motion one more time for me? Very good, very good. And then, so I'm just gonna line this up here. And then I'm gonna be doing the work, so you don't have to do it.
Okay.
Any pain with that?
Yeah.
Yeah?
No.
Oh,
no.
okay. All right. So you got 40 degrees. That's pretty good.
Okay.
45 is normal, but that's really good.
Okay. I'll take that.
So now that we did that, what we're going to be doing next is that I'm just going to be showing you what you're going to be doing while you're on there.
Okay.
So I'm going to transfer you. Actually, you're going to stay right there.
Okay.
And then what you're going to do is that I'm going to be pointing, putting my finger here in different
Okay.
places. Yep, I'm going to be putting my finger in different places, and I want you to point your toe towards those things.
Okay.
That's the first test, but before I even get to the first test, I just want to see if you can sense where your leg is at the moment before you even get there.
Okay. That sounds good.
So what I want you to do is, because you have complete feeling in this leg, so I'm gonna do the sensations on this side as a test, and then we're gonna actually do it on this one.
Mm-hmm.
All right. So then I want you to feel that this is going up.
Mm-hmm.
This is down.
Down. Okay.
This is internal rotation.
Okay.
External rotation.
Okay.
Okay. So then let's do this one more time. So
Up. Down. Internal rotation. External rotation.
and you can just say in and out. You don't have to be fancy
okay.
like me.
That sounds good.
All right. So then what I want you to do now is I want you to close your eyes. I want you to look that way. Other way. Perfect. All right. So
Up. Down. In. Like so.
mhm.
And out.
Okay.
Up. Down. In. Out.
Nice. Great.
All right.
So it seems like you have pretty good sensation in your leg, knowing where it is, which is a good start. But now we're going to work on your coordination.
Okay.
So now this is going back to the test where I'm gonna have my finger in a place, and I want you to use your right leg to meet my finger.
Okay.
Okay? All right, and then we're gonna do 3 sets of 4.
Okay.
Okay, so you ready? Okay, 1, 2, 3, 4. All right, rest it. And you shouldn't be getting any tired with this. If you do feel too tired, please let me know, because
Sure.
that's not the point of this exercise.
Okay.
Okay, do you feel ready to go?
Yes.
Okay. 3, 4, okay. And then we're gonna rest. Are you ready?
I'm ready.
Okay. 1, 2, 3, 4. That was good. You were able to do it. It was a little bit of compensation, it looked like, but that was good. That was good.
All right.
Good start. And then last, we have our Tenetti test, which again, this is just a little test just to show you or see where you are with your balance while you're moving and while you're not. So I'm just gonna do a demonstration, and then I guess what you're gonna do it. Yeah, so I'm gonna show you, and then you're gonna do it, and
Okay.
then we're gonna see how you do. Okay, so what you're gonna do is that you're gonna be sitting at the edge of the chair, and again, while you're doing this, I'm gonna be with you. But
Okay.
we're gonna be sitting, Then you're gonna stand with your eyes open for 5 seconds. Gonna close your eyes for like 10 seconds, and then I'm gonna just give you a little bit of nudges. I'm not gonna push you over. I'm just trying to see how you bounce back from the unbalance. And then you're gonna close your eyes, and you're gonna turn in a circle, and you're gonna sit back down.
Okay.
But again, I'll be instructing you while you're doing it. So
Alright.
I'll be right here. But before we do that, I'm going to get my stuff ready.
Okay.
My
Take your
stuff
time.
is here. Okay. All right. So then, if you can you just scooch to the edge of the seat, and then at the count of 3, we are going to stand and then walk to the chair.
Okay.
Okay. All right. 1, 2, 3. All right, and let's walk to the chair. Nice. And then you can scooch to the edge of the seat. So when it's time to start, we can start. Alrighty. Okay. So first, we're gonna stand up.
Okay.
1, 2, 3. Alrighty. And then now we are going to stand for 5 seconds. 1, 2, 3, 4, 5. Now you can close your eyes. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You can open your eyes again. I'm just going to give you small pushes, okay?
Okay.
All right, very good. And then now you're going to spin in a circle. Yep, I'm gonna guide you through. And then now you can sit back down on the edge of the seat. All right, how do you feel?
Pretty good.
Good. You did really good on that.
Thank you.
I noticed no balance issues. You handled the little nudges very well. So now I'm going to do a post-skin assessment, see how you do.
Okay.
I just want to look at your knees since that's what I measured. Can you just come back up here because I need to do that? Wait, no, don't move.
Okay.
Don't move.
Okay. I'll move.
In the nicest way possible. Okay. Ready? 1, 2, 3. All right, and now we're gonna go to the table. Spin around. All right. So now, what we're gonna do is do post.
Okay.
And then I'm just gonna look here. All right, there's no cuts, bruises, any pain in this area?
No.
Is there any pain in your hip?
No.
Okay, and then can you just bring your leg in, like how we did before? Good. Any pain with that?
No.
And then can you go all the way? Good. About the same amount of motion.
Sure.
Alrighty. And then for your home exercise program, it'll be similar to what we just did. If, for the coordination, I'm just gonna show you.
Sure.
It'll be like you pointing your toe, but like you can just point in different spots in front of the floor. So you could be like there, then go back, go to the side, and come back, go to the other side, come back. Just make sure that while you're doing it at home, you're in a chair.
Okay.
And you're gonna do the same amount of reps and set, 3 sets of 4. You shouldn't be feeling tired when you do it, and then you shouldn't feel any pain. If you do feel pain, then you need to stop, and then we'll reassess the next time you come back. Okay?
All right, that sounds good.
I want you to do that exercise twice a day.
Okay.
For like the remainder of your plan of care.
Okay.
So is there any questions that you have with that?
Nope.
Let me just double check my notes, but I think overall you did really great, and
Thank you.
it's been really nice working with you.
And you as well.
But before you go, what's your pain level now, if you have it?
Just like, same as before, like a 2 out of 10, I think. Just no change there.
Okay. All right. Well, that's good. It's
Yeah.
better than increasing pay.
I'll take that.
All right. So thanks for working with me, Matt.
Of course. Thank
All right.
you.